Hello and welcome dear learners to the NPTEL course on Nutritional Epidemiology, a way towards a healthy life. In continuation with the Module 1, Foundations and Principles of Nutritional Epidemiology, for the Chapter 5, we will be talking about the burdens of malnutrition and public health priorities. Here, we will be discussing about global and national burden of malnutrition, indicators of nutritional status, epidemiology of micronutrient deficiencies, nutrition-related disease burden and DALYs, priority nutrition problems in low and middle income countries, public health nutrition interventions and strategies. Also, we will be discussing about setting priorities for nutrition policies and programs. Global and national burden of malnutrition. So we can understand that malnutrition refers to deficiencies, excesses or imbalances in a person's intake of energy and or nutrient. It includes undernutrition, that is stunting, wasting and underweight, micronutrient deficiencies and overnutrient, that is overweight, obesity, diet-related non-communicable diseases. Public health priorities focuses on targeted interventions to reduce this burden, which is guided by the indicators like stunting and DALYs, that is disability related years. Progress towards 2025 WHO global nutrition target remain of course worldwide. The global burden is with undernutrition, overweight and mortality. Approximately 149 million children under the age 5 are stunted and 43 million suffer from wasting. Globally, with respect to obesity, over 2.5 billion adults are overweight, which includes 890 million living with obesity. With childhood overweight, that is obesity, which is affected roughly by 35 million children under the age of 5. Nearly 45% of death in children under 5 are related to undernutrition, primarily in low and middle income countries, which are more affected with respect to mortality. So there is a huge burden to be seen with respect to the three conditions. The national burden in India, which faces with world's highest child wasting rate, that is 18.7%, which is with the over 21 million children under 5 in 2024. With 37.4 million stunted and over 203 million anemic women with age 15 to 49. So you can see that is a huge burden to our country with respect to the nutrition. As on to June 2025, 5.46% of under 5 are wasted and 15.93 underweight per portion tracker data, which is being estimated. The projections show that India is missing 2025 targets within a 131 million stunted children expected. So there is a huge work to be done into this area of malnutrition. What are the indicators of nutritional status? That is stunting, wasting, anemia and obesity. If you see what is stunting, that is low height for an age, where wasting is low weight for height. Anemia contributes because of low hemoglobin level, and obesity is being seen to be understood as high BMI, that is body mass index, above 30 in adults, where stunting is reflection to chronic undernutrition and long-term deprivation, where wasting is being interpreted as a reflection to acute malnutrition, that is rapid weight loss or failure to gain. Anemia is an indicator of poor nutrition, that is iron and B12. It can also be contributed by health conditions like parasites and malaria. Obesity is being seen as excessive fat accumulation that is can lead to high risk for NCDs. Epidemiological of micronutrient deficiencies. The global patterns of micronutrient deficiencies, that is a hidden hunger, is affecting billions, notably because of more iron deficiencies, more iodine deficiencies, vitamins A, zinc and folate, which is contributing to the global burden. That is the hidden hunger among the globe. This population impaired with growth, cognitive level, immunity and maternal outcomes, which leads to the risk of lack of diversity, fortification coverage is low and infections are very common. Dietary inadequacy estimates that modeling analysis shows pervasive shortfalls in key micronutrients across regions, with low middle income countries bearing the largest burden. Food system constraints, affordability of diverse diets, and inequities drives these deficits. If we do talk about India, the National Review document states that high anemia prevalence in women and children, vitamin A deficiency pockets, suboptimal iodine status in some region despite the salt iodization, and widespread multiple nutrition gap. So why does it this reflects? This is more a reason because of intake, different dietary pattern, socio-cultural reasons, and the social determinants which affects this. The programmatic response which is needed of food fortification, supplementation which comes from macro and micronutrient, and dietary diversification efforts which can improve the health outcomes. Nutrition related disease burden and DALYs. The global burden related to disease burdens, that is dietary risk and mortality, where we find 7.5 million death accounts because of nutrition related disease condition. 187.7 million is affection, more lead because of high sodium, low whole grain or lesser inclusion of fruits, which increases the burden with respect to age and higher being seen in males. Low middle income countries burden with nutritional deficiencies, that is protein energy malnutrition particularly, which is increasing. There is the fifth highest risk factor for death globally, which is contributing to 180 million, and 70% of the NCD death which are contributed by disease condition like cardiovascular disease, type 2 diabetes and chronic kidney disease and certain cancers. So what is the key takeaway? So poor diet and high BMI are the major drivers for preventable NCDs and low health life yearly globally. Disability adjusted life years measures total disease burden as the sum of years of life lost, YLL, due to premature mortality, and years lived with disability, that is YLD. So the disability adjusted life years is being seen which contribution of malnutrition to DALYs is that child undernutrition. The top risk factors for DALYs in low income countries is being seen through children's. Iron deficiency anemia contributes substantially to years lived with disabilities of the remaining years. The global burden of disease shows persistent DALYs from undernutrition in children and rising DALYs from diet-related NCDs tied to overweight, obesity across 204 countries. Priority in nutritional problems in low and middle income countries. The unique challenges faced by low middle income countries due to fragile food system and economic transition, where you can find the inadequate nutrition in the first 1000 days, pregnancy to age 2, critical, very critical age for growth and development. The double burden at household. where at one level you may find some people are overweight, where versus the children may be found to be underweight. A vicious cycle of infection, nutrition, where you find the infection connected with reduced intake of food, or weight loss and impaired immunity are connected, which is very important to be seen. High consumption and ultra processed food, where you find that high beverages, overcooked, overprocessed, high salt and high sugar food consumption is increasing, which gives more energy dense and low nutrient options to the community, which is being seen as a very risk factor for increasing the disease condition, which ultimately leads to low health outcomes. Public health, nutrition, interventions and strategies. The very important strategy is to improve on breastfeeding, that is exclusive breastfeeding and complementary feeding, which is very important to tackle child malnutrition. It improves the growth and developmental burden of a child. Supplements of micronutrients to be added to this. Food fortification has been seen as a very important tool to tackle this issue, and management of acute malnutrition. Emphasis on maternal nutrition programs from Poshan Abhiyan to different nutrition programs like RBSK and RKSK, which are being seen very popularly to tackle the issues of malnutrition in our country. Health is one being seen as a very sensitive issue when it talks about nutrition. When food security issue, particularly for farmers, where the food security and agriculture programs contributes actually to be seen as a very important public health nutrition intervention. Social protection and cash transfer scheme can be added to give more choices for the population to take ahead nutrition as a choice. Water sanitation and hygiene can improve the disease condition and can also lead to be seen as a nutrition sensitive intervention, which is a more a topic of WASH. Women's education and empowerment can also contribute in improving the health outcomes of the children and the mother. Poverty elevation has been seen as a very base and a foundation of the malnutrition problem. At a policy level and system level strategies, the very first is a national nutrition policies and action plan to be stated to be a guiding and improving the nutritional status of the population. Integration of nutrition into primary health care is very important emphasis which is being given by National Health Policy 2017 of giving a direction towards a comprehensive primary health care, leading to school feeding programs which emphasizes on children and childhood development, contributing to the later years of reducing the DALYs. Then monitoring and surveillance system is very important to reduce the burden and improve the health outcome. Also, there is a very strong approach to be seen as multi-sectoral coordination between health, education, agriculture and social welfare, which has been seen as a very systematic way of dealing with this issue. Policy making follows a framework of feasibility, impact and cost effectiveness, where situation analysis, target vulnerability group and multi-sectoral alignment can give an evidence-based decision making for a larger impact, which has been seen as the setting priorities for nutritional policies and program in country like India. Principles for nutrition policy prioritization increases to see the burden and equity as very important aspect to be considered as target high daily burdens and severe inequalities. The goal needs to be aligned with the global nutrition targets and rather not with the individual country. The accountability and the targets need to be aligned with the global burden. Transform agri-food systems to enable healthy diet to the population, which is more a food system lens to be seen to this issue. Also, there should be a lens to understand and prioritize interventions with strong evidence and implementability, which is mostly a way to deal with cost effectiveness and feasibility. So, in this chapter, we have discussed about malnutrition, which affects over 25% of the global population, with 45 million children globally which are wasted and 149 million children which are stunted. Micronutrient deficiencies impact 50 to 60% of the women and children in low and middle income countries. Obesity or overweight has doubled globally now, with 2.5 million adults which are found to be overweight, and rising diet related NCDs is increasing in number. Even country like India is also facing this issue as a major. Nutrition related conditions contribute to 10 to 15% of global DALYs, disability adjusted life years, and 45% of under 5 children's death. So, priority action needs to include on exclusive breastfeeding. Support system needs to be developed till the level of community, food fortification, micronutrient supplementation, and healthy food environments. The policies of the country must target high burden groups, vulnerable groups, and also ensure cost effective delivery, and should align the global goals of 2030 of nutrition. So with this, we come an end to this chapter, and these are the few important references to be considered to go in detail with this topic. So thank you very much.